And you know this about me, about 2 years into building this company, I got hit by a car so hard that it threw my car into the other side of traffic and I landed on another car, got rushed to the ER, and it just one thing after another escalated. And within a week, I was one kidney down, right? And having that plan in place was a real security blanket for me and my family. And I wouldn't have even had that in place had I not started a company specifically around this. So
you're listening to the Venture Best Spotlight, a podcast by Venture Best, the venture capital and emerging companies practice group here at Michael Best and Friedrich. On this show, you'll hear from some of our amazing founder clients and network of venture capital managers. These individuals are inspiring instrumental changes to the way the venture economy produces, invests, does business, and defines what it means to be a startup.
Okay, hello. My name is Aaron Barker. I'm a partner of Michael Best, and I'm the head of the Venture Best program in Texas. And welcome to the Venture Best Spotlight. Today, my guest is Dr. Tatiana Fofanova. Tatiana is one of the founders and the chief executive officer of Koda Health. And Tatiana has a bachelor's from Rice and a PhD from the Baylor College of Medicine in translational biology and molecular medicine. So that's just a little bit of background on Tatiana. Tatiana, welcome to the Venture Best Spotlight.
Thank you, Aaron. It's always nice to see you.
Yeah, great to see you. So Tatiana and I have known each other a long time, been working together a long time, but for the benefit of listeners, Tatiana, perhaps you could give us a little bit about your background and how you kind of got started with the Koda Health idea.
Yeah, absolutely. So I am a clinical scientist by training. I come from a classic Russian immigrant family where everyone's a professor. Mom's a professor of applied mathematics. Brother's a professor of statistics. My father's a professor of computational physics. And so I decided to go into the soft science of medicine comparatively, much to the momentary chagrin of my family, and that's the path that was set out for me. I spent a long decade or so in clinical research at Baylor College of Medicine, did some work at Texas Children's. My work was in the pediatric ulcerative colitis and Crohn's population specifically. Took a couple of microbial therapeutics to phase 1s and IND, and that was all great. But honestly, for clinical science and research, I kind of got frustrated with the speed at which things moved and the speed at which you could make an impact in the patient populations you were working with. So towards the end of my research career, which, I'm relatively young, so it wasn't like a long and storied 40 years at an academic institution, but towards the end there, I started moonlighting for some venture capital funds and angel groups in Houston, initially doing some expert due diligence, but then shifting into portfolio work, helping them pivot into new clinical applications. And what started out as a sort of just a little bit of exploration to see what else was out there was my first introduction to entrepreneurship. And I really fell in love with the passion that entrepreneurs brought to wanting to change markets in a very short time period. And mistakenly, I think I looked at all these founders walking in through the doors of these VCs and thought, I could do that. How hard could it possibly be? And was eventually recruited into the TMC founder in residence program down in Houston. So that's where I met my two co-founders, Dr. Desh Mohan and Caitlin Cherry. We were matched and recruited from candidate pool from all over the country, all over the world, really, based on our background, our skill sets. And Koda spun out of that founder in residence program. It was created to address a problem we saw across effectively every clinical venue, which is that as patients become more seriously ill or approach end of life, they very often don't get the kind of care, the health care that aligns with their goals, their values. Sometimes it even goes against their religious preferences. And the reasoning behind it really falls down to process and access and really things that we thought we could fix via a scalable solution that helped patients get the kind of care that they want. So that's a very brief journey.
No, that's fantastic. And so I think, when you and I first met was when you were working with at TMC Innovation in the founder in residence program that you mentioned. So I do want to talk more about that because I think that's really interesting how you were connected with your co-founders and how you guys kind of, formed a team and came up with this idea. But before we get into that, I want to set the stage a bit more by you just giving us kind of an overview of what is Koda Health. Tell us about Koda Health.
Yeah, so Koda Health is a patient decision support platform that scales goals of care conversations for health systems, payers, a lot of healthcare organizations. That's a lot of specific jargon to say that our job is to make sure that the care that patients want is the care that they get. We have a patient-facing web application that guides patients through a lot of educational materials to learn more about their condition, to make informed decisions about their future care. If it's end of life care, they can make informed decisions about, hey, where's my line in the sand? What quality of life preferences are make or break for me? Or this is my medical power of attorney. These are my selections for CPR, feeding tubes, dialysis, ventilators. We pull their responses, generate state-specific legal documents. They can immediately virtually notarize right then and there on the platform. And everything is integrated into the electronic medical record of our client sites so that we have the most up-to-date information about that patient's preferences if or when they go into the hospital. We also have for the highest risk members of our populations that we work with. So those are either 12 to 18 months away from either an end of life event or an escalation of disease. Our newest kidney care product, we intervene before a patient gets onto dialysis, for example, in order to reroute them into more higher quality of life types of dialysis and give them that option rather than having them start dialysis in the emergency room. Long story short, for those high risk members, we also pair them with licensed clinical social workers and RNs to give them a little bit more hand-holding in that last 12 months as they approach that transition period. This allows us to have a really scalable way to address the advanced care planning and goals of care needs of everyone in a patient population, whether they're low risk, happy, going for a jog, super healthy, all the way up to patients that are in and out of the ER every 2 weeks. We can address everyone in that population. And the value prop here is that a patient with a plan on file through Koda has significantly better outcomes. They're an active participant in their own care coordination. For the health systems that we work with or that are our clients, those patients are about 19%, have a 19% reduction in total cost of care. So they're significantly cheaper to manage, which improves their outcomes, they get admitted to the hospital less, they have fewer terminal inpatient admissions, they spend less time in the hospital. And if they want an appropriate hospice referral, we're able to make that happen, all of that.
So that's amazing. So it seems like a lot of people who use Koda's product would encounter it at a time when they're sort of in a vulnerable position. There's a lot of very difficult conversations that have to happen or sometimes don't happen that should around what kind of care, folks want for all sorts of reasons, from just personal preference to, like you said, they may have religious reasons or all sorts of different reasons. So I mean, that's really interesting to me that Koda is sort of like bridging this gap where it's helping people who are facing some of the most difficult challenges they'll face in their life, and their loved ones too, who are trying to do what's right for for whoever is going through all this. And it seems like Koda the product makes that process easier on everyone and more understandable. I guess I'd be interested just to hear kind of your thoughts on what does it look like for someone who's dealing with these issues and is going to be using Koda to help them navigate? Like, what is the user experience?
Yeah, I mean, when we roll out to a system or a payer, if we're at a payer, we're a member benefit. So at Cigna, we're live with their entire Medicare Advantage population. As a member benefit, they can access Koda through their website. We have a single sign-on. There's marketing materials, all these things. Cigna also now incentivizes their members to engage with Koda. They pay them a member incentive, just like they would pay for a member to get a mammogram or a colonoscopy screen, which is huge in terms of, really signaling their belief in advanced care planning and the services that we offer as a preventative intervention or preventative service, right? Preventative care. If we're working with a health system, we're live at Houston Methodist, for example. We have clients like Centera and Privia and a number of different health systems across the country where, we reach patients in a real multimodal consumer native way. So if some patients are super users of MyChart, great. They get onto their patient record management system and they love that. They're constantly on it. Fantastic. Most are not. And so we do everything. We text them, we email them, we have marketing materials. Physicians are able to directly refer patients to us or do warm handoffs. Really, any way we can engage a patient, we do. And our back-end infrastructure allows that to really seamlessly connect into our overall patient management structure, right? And when we work with a system or a payer, we make it very explicit that everybody gets access to Koda. Whether you're super healthy and you're just the planning type, which there's always people that are just the planning type, or you're getting a little bit more seriously ill, because, who are we to draw that line to say you are seriously ill enough to get advanced care planning and you are not, right? That's silly. If a patient feels like they're in that bucket and they want to prepare, they're more than welcome to start preparing, and we will provide them with the appropriate level of services to make that happen.
Okay, so Koda is not always just something that you would first encounter when you're going through, like, that life stage, of dealing with serious medical issues. But perfectly healthy people use it because they're planners, like you said. They want to plan for, when that time comes.
Yep. And frankly, so I have an advanced care plan. You know this. We've known each other for a long time. I have an advanced directive. I have a medical power of attorney. I have a DNR, right? I have all these things that are important to me. I have a list of, quality of life preferences that are my line in the sand, that even for completely survivable treatments or, medical decisions that my husband might have to make in case I get hospitalized, it's not all about the binary, live or not live. It's, I'm unconscious and my husband has to make a decision about whether or not to amputate my leg, right? That's a hard decision to make. He has to make that decision. Having that conversation with him or putting it down on paper of what my quality of life would look like and what's my line in the sand helps him make that decision confidently. And you know this about me, about 2 years into building this company, I got hit by a car so hard that it threw my car into the other side of traffic and I landed on another car, got rushed to the ER, and it just one thing after another escalated. And within a week, I was one kidney down. And having that plan in place was a real security blanket for me and my family. And I wouldn't have even had that in place had I not started a company specifically around this.
Yeah, well, yeah, exactly. It's like none of us know what things could happen. And by the way, I'm so very glad that you're back in action and you made a full recovery, Tatiana. That is very scary. Was a very scary accident. But it just kind of goes to show that the value of these tools and using these types of tools before you're in a situation where you would be very difficult for you to be making these choices, or you're putting other loved ones in the position of making them for you, and they may not have all the information. So you mentioned your husband, and so I wanted to just talk a little bit about at TMC. I think you met your husband. So you're not only did you meet your co-founders of your business, but you met a co-founder of your family as well.
Of my life, a co-founder of my family. No, we have the lamest story in existence. We met at Demo Day, which is the most
Very entrepreneurial
story you could possibly have. So we met at Demo Day at the TMC, and I actually wanted his job. So he had been in the founder in residence program the year prior, and so I was introduced to him to learn more about the program. And not only did I get into the program and start on the founder in residence program, but I also met my future husband and father of my child, and life partner, business partner, all sorts of things. So the world is I like to joke that the only person I could find to tolerate my BS was somebody who is also an entrepreneur and also in the healthcare space.
Yeah. Well, you definitely seem very like-minded, and I think we should just maybe you could just tell us a little bit about Adrian, your husband Adrian, who I also know well. Adrian is quite entrepreneurial himself, and he and I have worked together on some projects over the years. Yeah, maybe you could just sort of tell us a little about Adrian and your family.
Yeah, I'd love to. So Adrian is, we both went to Rice. I went to Rice for undergrad. He went to Rice for business school. We did not meet there. We were both in the healthcare environment, and we didn't meet there either. We met at this Demo Day, right? And he's an incredibly ambitious individual, which I love and I can definitely resonate with. So he has started 2 companies. The first one was in the medical devices space, and fortunately he wrapped that one up really quickly when it needed to be wrapped up. So not everything can be a homer out the gate. You need to know when you wrap it up quick. And then the second one was in the primary care space. He was the first operational hire brought in by a experienced serial entrepreneur to basically make his idea come to life, which is actually ironically the offices I'm sitting in right now. I'm visiting Hamilton Health Box, which is the company that he helped build. He was their chief growth officer for a number of years before handing off the reins and taking a short sabbatical to dye his hair pink and go surfing in Mexico for 6 months.
Nice.
And now he runs a lot of the innovation side over at Rice University, helping spin out various technologies and investing in Rice affiliated companies. So he's really enjoying his work and helping other people build their companies and build their dreams. We are certainly very like-minded in that it's probably too much to share on a podcast, but
please continue.
Like we went ham on our prenup, even though at the time neither of us had any money, but we went ham on
Planners.
it because we just thought it was so fun to iron out all the different elements of this legal agreement. We vest into each other's equity. If one party takes a year off to raise kids, we vest into an extra 0.5% of the marital estate.
Gosh.
Went got really into this whole thing. And then once we ironed out all the stuff, we forgot to sign it because it was the exercise of just figuring everything out that was so fun. We're a bunch of nerds.
Yeah, well, I think I would call you sort of an entrepreneurial power couple. So you met Adrian at TMC Innovation, but you also met your co-founders of Koda Health. And so how did that process work? How did you come together? Were you assigned? Did you have a pool to select from? Tell us more about that.
So the way they do it now is not how the program was run when we did it. We were recruited based on having complementary personalities and ambitions and things like that. It was actually a wild process. We had to take multiple kinds of personality tests. They matched us with a psychologist, both before, during, and after the selection process. We were tracked by a psychologist the first, I think, 6 months of the founder in residence program. And it makes sense, right? The number one reason that early stage companies bust is founder disagreement. And so making sure that you set the groundwork for appropriate sort of founder discussions and founder working relationships from the get-go, especially if you have this non-traditional startup story. It wasn't like 3 people in a garage coding, right? We'd never met before the first day of the founder residence program, and all of a sudden we're showing up on day 1 and they're saying, congratulations, you're co-founders, have fun effectively being in an arranged marriage for the next 10 years and let's see what happens. Right? That's a heck of a thing to go into. So that was pretty great, pretty crazy. I think what was really lovely about Daesh and Caitlin is we all came into this with the prioritization of the co-founder relationship first and foremost. So even when we were deciding on what problems to address, what companies to start, the number one factor in deciding what projects we would work on or explore was if we were all 3 passionate about it. And it was rated blindly, where for each problem we were addressing, on a scale of 1 to 3, 2 out of the 3 members of the co-founding team had to be extremely interested or very interested in a particular direction before we even considered it as a startup direction for us. So really prioritizing our relationship and making sure that we had team cohesion in the early stages was great. And we were all very much in the same mind for that.
Yeah, so it's interesting, I've always heard in this venture business, I always hear investors talk about, invest in the team, not the idea. And I think Koda has a brilliant idea and the market's proving that out. But you also have one of the most vetted, sort of well-conceived, intentionally, like a lot of intentionality in your sort of origin story around putting the team together and all that. So I think, I think if I was an investor looking at companies and I was thinking about that mantra, invest in the team, I think Koda Health, you're not going to find a team that was more sort of, heavily vetted and intentionally put together specifically for their passions, but also their strengths and complementary. So I think that's super cool. And I think, it's evident in the progress you've made. And speaking of the progress you've made, I want to talk a little bit about, kind of where Koda is right now. I noticed recently that you announced a new deal with Guide Health. So tell us a little bit about what's going on with Guide Health, but also just more generally where Koda's at in its journey.
Yeah, so we are super excited about our partnership with Guide Health. I think it's just the beginning. They are a like-minded, they're also a startup, frankly. They're certainly ahead of us, but they are really focused on an AI enablement and primary care and making sure that they can identify who needs what interventions at what time. And so it really is a natural fit for what Koda does. We roll out, again, to everyone in a population, but we scale up our outreach and our intentionality depending on a patient's risk. The ones that need it the most get the most aggressive pursuit to make sure that we don't drop the ball and we can get them their plans and the kind of care that they need. And so I think for Guide Health, they are certainly a huge deal for us, but also one that has the potential to expand nationally. I think for us, the nature of healthcare is a lot of the clients that we have, we're not allowed to talk about, right? There's a lot of, hush hush on these things. And when we do get a client or a partner that wants to shout it from the rooftops, man, do we get excited, right? And so it's interesting because, Koda as a company are raising our Series A right now. It's off the back of some honestly stellar impact and cost savings data. We're the only digital solution on the market that has shown true ROI and significant ROI in terms of total cost of care, terminal admissions, all these different metrics that a lot of these health systems and payers really care about, and these patients really care about, right? At a time that is a little bit chaotic in the market. I don't know if you've noticed, you've opened up any of the news channels lately.
A little bit
but
of
there's
turmoil.
a lot of, yeah, but there's a lot of focus, especially in healthcare, on cost savings, cost containment, all of that. And we, I think, are in a really interesting and really good place because if 25% of all Medicare spend is in that last year of life, and we can reduce that by 19% just by making sure that we listen to and follow our patients' wishes, that's great. That's win-win-win for everyone. And so we've grown probably 4x quarter over quarter in terms of revenue. We're on track, which is a good thing to say and a fun place to be. After 3 years of building with a company like ours, sometimes you have to spend multiple years building a thing before it's sellable to even one organization. So you invest a lot of your time, effort, and money. You have a high confidence, but you don't know if there's actually going to be appetite for it. And we're in this position now where we're actually seeing that experiment play out and seeing the fruits of our labor and all of our hopes and dreams sort of start to accelerate, which is good.
Yeah. And I see it again and again. That's the best time. The best position for clients to raise capital from is where the product has already, it's a proven winner. The demand is there, and it's really looking for capital to scale it up. That's just need the kind of growth. It's a growth story from here on out to some extent. I'm sure you'll iterate on the product and all that good stuff too. But I just love
there's a lot of product build still left.
Oh yeah, no doubt,
right?
No doubt. That kind of never ends, I suppose.
Yeah.
And I noticed a few months ago you won the Best Female-Owned Business Award at the Houston Innovation Awards.
I did. Well, so yes. And, the amazing thing there is obviously at Koda, everybody builds this really impressive business. Caitlin is a co-founder, and she's an amazing woman who has had to navigate so many different challenges. Being a woman founder, being a first-time founder and being a woman founder has a lot of challenges associated with it. But, frankly, I raised my last round and closed it 6 days before I gave birth to my son. And I think that was like the domino that like tipped that over, where, the company is absolutely phenomenal. What we built is phenomenal. We're like 60%, 65% women on the team. We're an incredibly diverse team. And there's so many things that we've built. But I remember sending off documents for signatures in early labor. And there's like a part of me that's like, yeah, we deserve the award. But how much of the award was because somebody looked at that and was like, that's psychotic. We should give her like a consolation prize for the chaos she went through, because that's a whole nother beast.
Well, yeah, I mean, I think it's an incredible part of the story. I love working with underrepresented founders and, of course, female founders. And I think smart investors understand that there's a lot of potential there, too. And it's I think, just a great part of the story. I think obviously the success of Koda Health is amazing. And so it's good that we're focusing on that. But maybe, if you don't mind, I'd love to just for you to talk a little bit about what are the challenges of being a female founder or an underrepresented founder, or also balancing family life while you build this amazing business.
Yeah, absolutely. I love talking about this. So I think many women run their companies differently from men. Many women don't. So I'm not going to blanket speak for everyone here, but a lot of women, myself included, face, I think, very clear biases in the market. And that's not anecdotal. You can see that in the research, right? If you have an all-women founding team, your likelihood of securing venture capital is somewhere around 2%, or maybe it's 4%. If you have one man on your team, on your co-founding team, your probability of closing a round skyrockets to 16%, right? It's you get that bias all the time, right? And that's not to say that it's impossible in any way, shape, or form. You just might have to fill up more of the top of funnel than you expected and be very careful of how you select your partners, right? So I'm very lucky in that all of our investors couldn't give a flying flip and probably give us more credit for having the grit to pursue everything we're pursuing despite pushback occasionally from the market. And the biases are small. Sometimes they're big. Sometimes they're very direct. I will say there are a few people out there where you're like, oh man, you should not say that out loud. Are you sober? These are not statements that sober people should make. That always baffle me, right? But most of the time, the biases are really small, where me and my co-founder Desh will get on a call and they'll call him Dr. Mohan, but they'll call me Miss Fofanova, or they'll ask him to pitch the company. He has to redirect questions about equity and fundraising, or pitching the company back to me, or probably a quarter of the time I get mistaken for the PR person at the company rather than the CEO person at the company, which, small difference. So, and like, that's all fine. It's just those small things kind of grate at you, and it means you just need a little bit more fuel in the tank in order to get the same distance, right? So I think those are some of the biases that you see. There's a lot of quote unquote pattern matching in venture. And first time female founders that are not always part of the pattern for certain investors, but other investors see it as a huge opportunity, right? They see the grit. They see that historically women founded companies and women run companies actually perform 15% better. They have a higher rate of return. There's also a little bit of that, chip on the shoulder element that makes underrepresented founders just run a little bit harder and faster and longer. No offense, Eric.
No, taken.
I'm sure you're an incredibly hardworking individual. It's just, what the data shows. And then in terms of balancing work and family life, first off, men have families too.
Yes.
And they are doing the same. Very often women get asked that question because there's the assumption that women are taking significantly more. I wouldn't even say I'm lucky. It's a basic expectation for Adrian to be an equal participant in parenthood, and he very much is. When we got married, it was, hey, this is a life partnership, but it's also a business partnership. I can't be doing it all. You can't be doing it all. We have to give and take. And, when it comes to balancing family and work, right now I'm fundraising. He's taking on more of the family. That's the truth of how that works, right? And he's happy to do it because it's the joint partnership of the marriage and the family that is moving forward. And at some point in life, I'll take on some of that slack and that responsibility so that he can pursue some of his dreams and do the hard thing. Yeah.
Yeah. Well, I kind of hesitated, honestly, to ask the question because it's not a question that gets asked of male founders as often, but I feel like it's important because I think people, it's good for people to hear about kind of how it works. I think your answer was excellent that, you guys view parenthood as a total partnership where you both kind of cover for each other when needed, and all that good stuff. And I also just think sort of listeners, I think they would be interested. But I thought about it before I asked the question of, is it fair to ask, given that you might not ask that of a male founder? But I actually am going to make a point. If I am so lucky to host another one I will make a point of asking that question to all comers from now on.
Good. I would love to see the face of a male founder when you ask them how they manage work and family life. I can't wait. Although I will say one thing that was a real shock for me is I thought, when I have a kid, I'm going to be so much more stressed because now I have two babies. I have the startup and I have my child. And I think it's made me a significantly more productive person, in part because at 4:30, my nanny leaves. And from 4:30 to 7:30, I have to completely remove my brain from my work and spend time in a completely different kid universe. And it's like a forced reset. And then when he goes to bed, I get back to work. But it's that moment of required time out that has really improved not just my productivity, but increased clarity of thinking and reduced my anxiety, reduced my stress, just made everything a lot more enjoyable, frankly. And it's a long haul. It's a long journey. So
yeah, no doubt. I think I really liked what you said earlier about how, smart investors, savvy investors are recognizing that underrepresented founders, female founders, there's actually a benefit. It's like, because of those conscious or unconscious biases that you talked about, that those types of businesses with those types of founders could be overlooked, and therefore there's sort of like what they call alpha in those types of businesses. There's extra potential that others aren't seeing, and so I think that's really key, that smart investors recognize that and see opportunity. And I think obviously your company is proving that out.
Really quick, as a side story, in my last round, I have a investor, a VC, who runs 2 funds separately, but I met him at a networking event and I was 8.5 months pregnant. And, Adrian waved me over and was like, hey, you should meet this guy. He would be an interesting person for you to talk to. He invests in this field, blah, blah, blah. Then Adrian scampered off. And I waddled over like the beached whale that I was, sat down on a bench and pitched him like an angel pitch, 8.5 months pregnant. After that conversation, we got on one diligence call and he goes, I don't think I've ever seen anybody that round and that tired give such an emphatic pitch. He wrote me a huge check, and he runs 2 different venture funds on his like own time. But he wrote me a huge check of his own personal cash, and he's doubling down on this round. And it just goes to show that there are folks out there who really see the passion and the work and the effort that people are bringing to the table.
Absolutely. I think it's incredible that you're at a networking event 8.5 months pregnant. I wouldn't go to a networking event if it's been like a hard day at work and I'm feeling a little worn down. You certainly do have the grit that you were talking about earlier. That I think that demonstrates that for sure. Well, what's next for Koda? Where are you going? So obviously you're raising capital. I'm sure that will, be a successful process. And then what happens next? I mean, that you can reveal. I'm sure a lot of stuff is still kind of under wraps.
Well, for us, I mentioned that we have one product on the market, one product that's recently entered the market. So we have an end of life or serious illness product in advanced care planning. We just launched a kidney care product. Our goal and what we're really doubling down on is to become a patient decision support platform, right? I think we've proven ourselves out. We've driven value for a lot of our health system partners and payer partners. We've frankly gotten the foot in the door with some of the biggest logos and names in this space. And so for us, really doubling down on helping patients become an active participant in their own decision making, their own care coordination. We see it as a massive opportunity, not just to capture more market share, but to expand the contracts we already have with some of the biggest names in the game. And so if you haven't seen us, because we're B2B, right? We're not going to be on a commercial on ABC News telling you to download our app. But if you haven't seen us through your payer or health system, you might soon, especially if you're in Texas. Hint, hint, nudge, nudge. We're really gobbling up a few big names down here. Now, I think you will, right? Commercially, that's where we're going. Operationally, I think it's a really exciting time for any company, not just Koda, because there's so many new innovations. And I'm sure you hear the words AI, 16 ways to Sunday every day from every founder, VC, and lawyer. But I think it takes less to get farther now. And that is also a really exciting premise for a founder. And it has changed the way founders think about scale and what it takes to scale. And I think I'm really excited, both for Koda, but for the industry in general, to see what that means for companies, what that means for the VC founder dynamic, what that means for the industry overall. I think that's going to be pretty great.
Yeah, no. So for anyone keeping score at home, I want to summarize a few things, but please jump in and correct me if I misrepresenting anything. So Koda is a enterprise SaaS product. It's a platform technology, so that, currently there are a number of products that you've got out on the market, but there's potential for so many more. So where am I going with this? I think that it seems like the potential for growth and scaling is sort of infinite. It's kind of like the exact one I was going to add, and it's also a technology that leverages AI, and the potential to further leverage AI and grow that aspect of it is sort of
Yeah.
Obviously incredible. And so it just seems like it's right in the sweet spot of, where you want to be, and I guess it's interesting you mentioned too that, it is B2B, but it doesn't always have to be. I mean, that's the current strategy, but that you correct me if I'm wrong, but you can sort of envision a world where maybe people would be interested in signing up for it directly.
Yeah. And I think for us, that's an opportunity, especially if a patient leaves, for example, Houston Methodists and wants to take their plans to another health system. That's also a marketing channel for us. We have a patient that loves our product enough to be able to bring it to their new provider organization, their new health system, their new plan. Right. And I think that's an opportunity for us, certainly, to move it to a direct to consumer type of approach. What I will also say is the world population is aging and becoming more chronically ill. So this is, there's a huge opportunity in the United States. We're obviously focusing on the United States. We got to get this part right first. But we've been approached by like the government of Japan. They have a rapidly aging population and not a lot of solutions to control for costs and make sure that patients get the kind of care that aligns with their goals, right? This is not a US specific problem, although it's certainly a hefty financial pain point. And so there's so much to do in this space. It's truly nascent. And it also boggles me that it is nascent, this concept of enabling a patient to fully participate in their own decisions and their own care. I think there's a lot to explore here.
Yeah, well, I mean, it's like you said, it's got worldwide potential, and it's got a growing market as populations age, which is happening, demographically and sort of all over the world. And so, yeah, I think that makes a ton of sense. I know from some of our discussion prior to the beginning that you have another engagement to get to, and I don't want to keep you beyond time. I know you're so busy, as we've talked about. But Dr. Fofanova, thank you for joining us on the Venture Best Spotlight. Anything else that we didn't cover? Anything else you'd like to shout out or tell people to keep an eye open for, that sort of thing?
Yeah, one thing. Aaron, the host of this podcast, I have followed him to his now third firm. For very good reasons. Shout out to Aaron, one of the best startup lawyers I've ever worked with and referred a lot of folks to. So that's the one thing I want to note is when Koda started, you were teaching me what a safe was and really, really basic stuff. And where there was, not a hint of judgment and a lot of investment into the relationship, into the vision, into the potential. And so in terms of a strong ally and a good lawyer, not going to lie, you guys should go with Aaron Barker.
That's very, very kind of you, Tatiana. Thank you so much. I really genuinely value my clients who have been with me a long time, and we developed, obviously a working relationship, but I think we're also friends. And I think that that's just the most fun. I think when you have that kind of relationship with your clients, the work is fun. Working with them is a lot of fun. And watching them be successful is thrilling. And that's what it's been for me, is watching you and your team succeed. And I know that, the best is yet to come.
And to anyone listening, I swear this is not a paid advertisement. He did not ask me to say this. This was totally off the cuff, I promise.
Thank you for the record. Well, again, Dr. Fofanova, thank you so much for being on the Venture Best Spotlight, and I'm sure we'll be hearing a lot more from you. And, I'd recommend anybody listening, look for Dr. Fofanova on LinkedIn. I think maybe we'll include kind of a link to you when we start promoting the episode, and also it's worth following Koda Health, and I think it's going to be an amazing journey.
And that's a wrap on today's show. Thank you for listening to the Venture Best Spotlight. Don't miss another episode. Be sure to subscribe on Spotify, Apple Podcasts, and YouTube today. And if you really enjoyed today's content, please take a moment to rate and review the episode on your favorite podcast platform. Have a great day.